And we're live. Hello and welcome, everyone. Thanks for joining us this evening. We are yet again having an amazing platform that we can share some incredible information with you guys. I just get so excited every time we get to do these talks because it seems like we just hit the nail on what our community needs to hear. So welcome and hi, everyone. Swipe in if you're joining us. We're going to be over on Jeff Together, and we're going to be over on Sipla's Facebook page as well. So if you're joining us, swipe in and say hi. Tonight we're talking about allergies, and I'm joined by Dr. Shaunagh Emanuel, and we're talking specifically about what are the most common allergies and what are the most common culprits. And yeah, I'm excited because this is a very, very relevant topic, especially with seasonal changes as well, and how a lot of people struggle with this. So let me just go and quickly find us, and then let me just mute this quickly. And swipe in if you're here, say hi, and let us know if you're here. Hi, everyone. Thanks for joining us. I'm just trying to find the comments quickly. Awesome. Hello, hello. Okay, great stuff. Thanks for joining us, everyone. And yeah, very excited. So, Doctor, I'm very excited to chat to you because for my family, hi, Nicole. My family personally, we've been struggling with a lot of allergies and intolerances, and yeah, just trying to make sense of how to live healthy lives, but at the same time, not let it debilitate us, to be able to do the things that we love doing and knowing how to identify the symptoms and dealing with those. So yeah, I thought we would kick right off. So just to quickly introduce you all to who Dr. Shaunagh is. So Dr. Shaunagh is a general, sorry, not a general practitioner. I totally messed that up. Not a general practitioner, a doctor who takes a special interest in allergies. And I think that it is so useful to be able to have a doctor that you can talk to. Like I said, for us personally, we had that in our pediatrician, a doctor who can service us, but at the same time know our special needs and the things that we as a family have to deal with and helping us to cope with that. So thank you, doctor, for taking the time to speak to us tonight. And should we just kick right off and say, what is an allergy?
Well, thank you very much for having me. It's a great pleasure to be here. Well, to start off with that question, I think we really need to think about the immune system. The immune system is a collection of cells and substances that works tirelessly every second of the day to keep the body from harm. And it is essentially a highly sensitive and specialized security system that's designed to recognize any sort of threat to the body. And should a threat be encountered, it mounts an immune response. So sometimes, though, the immune response is mounted to molecules or substances that it perceives as threats, but they are in fact harmless. These might be inhaled substances like pollen, or foods like egg, or medications like penicillin. And so to summarize, allergy is the body's response initiated by the immune system to a substance that would usually be harmless to most people. So for example, if Sam is allergic to peanuts, he eats a chocolate muffin with well-disguised peanut sprinkles on top that he fails to notice, and a few minutes later, after eating the muffin, he develops a rash and a cough and he begins to wheeze. And this is an allergic reaction to peanut, an over-enthusiastic immune response to what would normally be a harmless food. So this is exactly what allergy is.
Awesome. That's so great. You summed it up so nicely. And then I had a follow-up question for you because this is a common misconception. So what is an intolerance then? If that's what an allergy is, then what is an intolerance?
Well, an allergy and an intolerance are both hypersensitivity reactions, but intolerance is not IgE mediated. So it's not the immunoglobulin E arm of the immune system that is being initiated. So, and it's always dose dependent. So it means that the more you give, or the more the person receives, the more sensitive they'll be, or the more they'll express their sensitivity. Whereas with IgE mediated allergy, you need very little of it. So you could just have half a peanut and you could have a severe reaction. But usually with an intolerance, that hypersensitivity is dose dependent.
Awesome. So what can trigger an allergic reaction then? You've said, someone with a peanut allergy, like a tiny little bit of peanuts, but what are some of the other triggers that we can be exposed to or that could trigger that reaction?
Yeah. So people have allergic reactions to molecules to which they have been previously sensitized. For instance, if you encounter, for instance, Bermuda grass pollen, and your immune system recognizes it as a potential threat, you will make allergy antibodies called immunoglobulin E to that pollen specifically. And the next time your body comes into contact with Bermuda grass pollen, it recognizes it and mounts an immune response against it. And this could manifest as hay fever or asthma or even itchy skin. And there are many molecules that allergic individuals can be sensitized to. So these include things like aeroallergens. These are molecules you can breathe in, like grass or tree pollens, house dust mite, animal dander, molds. There could be foods like seafood, peanuts, or egg, or insect stings, like, for instance, wasp or bee stings, and then many different types of medications, like antibiotics or anesthetics.
Sure. Yeah, I personally struggle with a sulfur allergy. So I see
Right.
you when you mentioned preservatives, and that's something that's in so much, and especially in seasonings and spices and things that we don't even realize that it's in. And you're right. Like we develop a sensitivity that if we have the slightest little bit of it, then you start reacting. It's not necessarily just a small dose. It becomes so intense that you have to almost expect the anaphylactic reaction or the most severe reaction to that tiny little dose. And I think that's so important for us to realize and recognize this. So if we have people in our lives that have allergies, if we ourselves are struggling with allergies, it's nice to know and to have an understanding of why we're reacting. But at the same time, if people in our lives have it, that we can help create an environment that is not causing any harm to them, or not judging someone for not having peanuts in the air, because they can actually have it from breathing it in. It's not just from eating it.
Yeah, absolutely. I mean, especially with food allergy, and especially with certain types of foods. Peanut is a really good example. Peanut, egg, seafood, those types of molecules are extremely allergenic. So people who have allergies to those particular types of foods don't usually need very much of it to initiate a reaction.
Yeah, exactly. And you mentioned through inhalation, ingestion, and then also injection as well.
Yeah, so your body has immune cells ready to protect it at every interface with the environment. So in the skin, in the eyes, the nose, and the throat, in the lungs, in the gut, and in the bloodstream. So whether you inhale a molecule or ingest it or touch it or get it injected, if you happen to be sensitized to that specific substance, your body may mount an immune response and you may have symptoms. So let's say if it's in the skin, you could get hives. If it's in the lung, you could in the lungs you could get a tight chest. If it's in the nose, you could become congested. So as you can see, you could be exposed to an allergen in a variety of ways. It just depends on where you happen to come into contact with it.
It's so fascinating, because how many people actually have allergies, but they just fight through the symptoms and don't even realize that that's exactly what it is.
Yeah.
And just deal with the uncomfortable like feeling like of a rash when they exposed to super cold water or whatever it is.
Yeah,
people just
absolutely.
fight through that. So there's a very, very common question that we get, and I just want to welcome everyone that's joined us in the meantime. Hi, and welcome everyone. If you just joined us, I'm talking to Dr. Shaunagh Emanuel about allergies specifically. So hi, good evening. Hi, Candace. Nice to have you with us. She says she's a allergy sufferer of 31 years. So yeah, welcome, Candace, and it's great to be able to raise awareness as well and to share with others. Hi, challengers. Nice to have you guys with us as well. Awesome. All right, so we're going to go right into it. So one of the common questions that people ask all the time is, are allergies hereditary?
Well, there certainly is a genetic component to the development of allergy, but environment plays an enormous role as well. But just to put it in perspective, if a child has two parents with some sort of allergic condition, let's say mom has allergic rhinitis and dad has asthma, then that child has at least a 60% chance of developing an allergic condition. So genetics definitely plays a very important role.
Interesting. Yeah, that's fascinating. And so how many people suffer from allergic diseases, would you say? And I think that's such a random question, or such a broad question, but in our general sphere in South Africa,
Okay.
how
Well,
common
it's
is
common.
it?
I mean, that's the bottom line is it's a very common condition, allergy. I think it's important to talk about allergy in a sort of broad sense. So there's a good word for it, which is called atopy. Atopy is a nice umbrella term that sort of covers all these allergic conditions. So if you happen to sort of have the genetic predisposition to be an allergic individual and you express it clinically, you could, for instance, have eczema, or you could have hay fever, or you could have asthma, or you could have food allergies, and you are then an atopic individual. And atopy is extremely common. Very broadly speaking, in South Africa, allergic rhinitis or hay fever occurs in about 30% of the population. So that's a large number of people. Asthma and eczema occur in about 10% of the population. And then food allergies, which are especially prevalent in children, in about 2% of the population. So if you put that into perspective, you're looking at about 16 million people with allergic rhinitis, also known as hay fever, in South Africa. And if you're thinking of asthma, about almost 2 million children have asthma in South Africa. So, allergy has a very, very high prevalence in this country and worldwide. Our figures are very similar to worldwide figures.
Yeah, that's interesting. Yeah. And so how does allergic disease affect us economically? Because,
this obviously leads into the economics. Not only do a lot of people have allergies, but people who have allergies tend to have chronic, recurring conditions that need consistent treatment for months to years at a time. There's no quick fix for them. So this makes the cost of treating allergic disease very high. The cost of allergies to the South African economy is in excess of R500 million a year. And the two biggest contributors are expenditure on healthcare and medications, and then also loss of earnings and time. People are either not efficient at work, or they call in sick, and children at school are often tired from interrupted sleep. They struggle to concentrate, or they're too ill to attend. And also, parents often have to take time off in order to care for children who cannot attend school because of asthma or allergies. So the economic burden of allergic disease is enormous.
Yeah, absolutely. And you touched on this, but so because of the economic effects on treatment. So how are allergic diseases treated then? What type of allergy treatments are out there for people?
Well, first of all, what we need to try and do is avoid the allergen if possible. But this is not always easy to do. To avoid grass pollen. To avoid grass pollen in the summer or house dust mite in the winter is practically impossible. So most people require some sort of treatment. Essentially, allergy is expressed as inflammation. So if the inflammation is in the skin, you've got eczema. If it's in the lungs, you've got asthma. If it's in the nose, you've got allergic rhinitis. So the key to allergy management is to control inflammation and to manage symptoms so that people can get on with their lives, even though their immune systems continue to overreact to harmless molecules in the environment. So cortisone can be used safely over long periods of time as long as it's used topically. This means that it's not ingested or injected. So there are topical cortisone creams for eczema, inhalers for asthma, nasal sprays for allergic rhinitis. And this cortisone is a very strong anti-inflammatory. Histamine plays a very large role in inflammation. So antihistamines are used to manage the symptoms of allergic disease, especially in allergic rhinitis. There are other anti-inflammatory medications and biologics which are available, and they are used in special circumstances. But usually we use a sort of combination of antihistamines and corticosteroids for all of these allergic conditions.
Awesome. And okay, great. That's great to know. So for very many of these things, you would need a prescription, obviously, because they're not necessarily over the counter. So what would you recommend for people to get the treatment that they need?
Okay, well, I have to say much of allergy medication that we offer patients is in fact bought over the counter.
Okay.
Nice. But the important thing for patients is to understand why they have allergies and therefore how their medications work. And if they don't know why they are taking them and they don't know how to use them properly, they will have very little chance of success, because allergy treatment requires real understanding and commitment by the patient, because the disease is chronic and it is relentless. It's boring to take medications every day. So it needs to become a routine, like brushing your teeth, if you happen to brush your teeth routinely. But the important thing with with allergy treatment is that people understand why they're taking it and which medication is working for which symptoms, and then they can use the medication as tools. Because the condition is chronic, and because they have to live with it for pretty much every day of their lives, they will have some sort of symptoms. They need to understand what works for them and learn to self-manage. And that really just takes a good partnership with their doctor in order to work out how to best use what is available to them.
Absolutely. I think from personal experience and from, just family, because you talked about the hereditary aspect already. My allergies definitely related to my mom's allergies. And we've found that, trying to treat it on your own, you can, but it's always great to have that partnership with your doctor, because your doctor would know, because, cortisone or antihistamine, I'm sure you can tell me more about that. It comes at a cost, though. There's, having to take it consistently, if you don't necessarily need the high doses, comes at that cost. So working with your doctor to make sure that you've got the right dosage, to make sure that you're not, you're not treating it in the wrong way either, because you could be treating the wrong elements of your allergy as well. So it's imperative to have a doctor that you can work with that's going to help you and guide you along that, which is so good.
Yeah. The other important thing is that allergies change over time.
True.
So children might start off with food allergy, which sort of disappears over a period of 2 years or so. And then they develop allergic rhinitis and asthma. They might have had a bit of eczema in the background that sort of comes back again in teenagehood. And during that time, to be able to learn how to manage the stuff, you've got to be able to manage your own condition. It's important to learn to self-manage, because it's a chronic condition, but it does take a lot of guidance to implement treatment as things change and as things go along, to be on the right medication, and then also to come off it, to learn how to step off medication when it's not necessary anymore.
Exactly. Because you don't want to be on it if you don't need to be anymore either. So that's
I mean, a lot of kids at junior school, sort of in that sort of late junior school phase, sort of have eczema and allergic rhinitis and asthma, and they're all active at the same time, and so they're on a lot of medication, and they sort of need to be, just to get them through that patch. But they reach puberty, and all of a sudden the change in hormones changes the way they respond and how they express their condition, and suddenly a whole lot of it becomes manageable. So some of the cortisone can actually be removed. Some of the treatment can be stepped down, and you need to be able to learn to to respond to those changes, and that is important to understand, that it doesn't always last. It can be a couple of years where you really are treating a child's symptoms quite actively, and then you can draw back a lot. So it's not always going to be as intense chronically as it is in sort of early childhood, where often we are really having to kind of treat them very very proactively, actually.
Yeah, awesome. That's great. And so you mentioned antihistamines. So in your professional opinion, what would be a good antihistamine for people to look out for?
Okay, well, there are all sorts of different antihistamines available, and it can be confusing to make a choice. An important consideration is whether you choose a first or a second generation antihistamine. There are more old-fashioned ones. These are the first generation antihistamines, and they are effective, but they tend to make people drowsy, and the effect doesn't last for a full day. And the newer ones are called second generation antihistamines, and they've been designed not to be able to cross the blood-brain barrier so easily. So they are less sedating, and they provide symptom relief for longer, up to 24 hours. So an example of this kind of antihistamine would be Fexo, which is fexofenadine. Fexo comes in 2 strengths, and it's not only long-acting and non-drowsy, but it also contains no sugar. So I would be happy to choose this antihistamine, for instance, to treat a patient with allergic rhinitis.
Yes, that's amazing. Awesome. And what are some of the benefits, some of the key benefits that you would, the FEXO molecule that you were explaining, what would you say?
I would say the key benefits, the very strong benefit is that it's non-drowsy, that it's not a sedating antihistamine. And then the other thing is it has a very long period of action. So you actually only need to use it once a day. Yeah.
Fantastic. Awesome. Thank you so much. Okay, so I'm going to open it up. We've covered all of our questions very quickly, and I love it because this is a two-part series, and we're going to talk about it some more next week. So I'm going to open it up to the comments quickly and see if there's any questions. So guys, pop your questions over in the comments for us because we would love to hear them. So one of the questions that Candace had, can stressful situations exacerbate allergies?
Most certainly. So we have a sort of a neuroendocrine system. Our bodies are very sensitive to external factors, but also internal factors. So our nervous system and our endocrine system, which is your hormones, play an enormous role in your expression of allergy. And so certainly, I have a lot of patients who have eczema, and they will, anecdotally, from my point of view, I'll often have patients who will tell me that their eczema is just out of control, and it often happens sort of around exams or when they've got a very stressful presentation to give or something like that. But I mean, lots of studies have been done, and you can actually you can see quite clearly that there is a neuroendocrine response to in allergy. Yeah.
Awesome. Yeah, exactly. I definitely can attest to that from my own personal experiences too. Yeah, I think a couple of people responded and said definitely does for me as well. Shame, yes, Candace is saying she wishes there was a way to make it go away. This is in a follow-up to her question that she says her doctor told her that her IBS is a lifestyle disease and there's not much that he can do, that she has to change her lifestyle. Incredibly difficult and isolating. Yeah, Candace, I think very many people feel that when you have a diagnosis of an allergy, or we talked about intolerances before too, that it feels like you have to make major changes. But I think there's a lot more information and a lot more resources out there than there was 10 years ago. I feel like we've come such a long way in the last decade when it comes to these topics. So don't feel isolated. Find maybe a second opinion. I don't want to, I don't know who your doctor is, so I'm not going to give a negative review on your doctor, but it's always great to go for multiple opinions, because in my personal experience, I felt that something was wrong with my son's digestion, and we just we went to the regular ped, and doctor and I talked about this in the beginning. I went to a doctor that's like across the road from her, and he was a lifesaver because we walked in, and because he specializes in allergies, pediatrician, but he specializes in allergies. We walked in and he immediately could tell us what was going on just looking at my son's, like the way that he was presenting, and listening to all the allergies and the reactions as well. And so I think it's very, very invaluable to not feel isolating, to get someone who can give you a second opinion, and also to find, there's a lot of Facebook groups out there that are people that are in support groups with each other too. So also just finding someone that you can talk to that are dealing with the same things, because they have lots of tips on how to change your lifestyle. And doctor, do you have any tips for Candace?
Yeah, I do actually. I think you want to live your life in a way that supports your microbiome as best possible. So I don't know if you're familiar with the concept, but the idea is that you have a whole community of bugs in your gastrointestinal system, which are your friends, and they weigh about the same sort of weight as your brain. It's about as much as that. It's just under a kilo of gastrointestinal bugs that care for you, and they make sure that you digest properly, and they make sure that your nutrition is what it should be, and they help vitamins cross over into your bloodstream from your gut and so on. And if you live a lifestyle that supports a good, healthy microbiome, you're likely to be more healthy in general. And I know irritable bowel syndrome is not just about the microbiome. There's a lot more to it than that. But as a basic fundamental approach, I would say the first thing is, most important of all, is to get enough sleep. It's a really very important detail in terms of regenerating and resetting everything for the following day, because it's hard work being your gastrointestinal tract. It has so many jobs, and it really takes on an enormous amount on a daily basis. And every day it needs to be rested. And I think that we live quite busy lives, and because of electricity and because we tend to work, hard, long hours, we often stay up late at night. And that's one of the really important ways that you can support your immune system and your microbiome, is just to get enough sleep. And then secondly, hydration and nutrition, essential. And then another really important aspect is happiness. I know that sounds sort of a bit far-fetched, but the point is your gut is very much central to, or happiness is central to the way your gut responds. And so I think that having a sort of, to de-stress yourself as much as possible. And one of the ways to do that, apart from sleeping and eating well and having enough hydration, is to get exercise. So I think a combination of all of those aspects, and none of them need to be very dramatic. They just need to be consistent. But if you consistently get enough sleep and your nutrition is consistently good enough, and if you can do a reasonable amount of exercise on a weekly basis, that's a good start. And if you really, really kind of look hard at how your lifestyle is set up, you can usually find quite a few little areas in which those things can be tweaked. And a small tweak here or there makes an enormous difference, often in the long run. Yeah.
Absolutely. And we, you sounded just like a coach right now, just FYI.
Well, allergy is all about balance, and balance is, I mean, that's the way to start, I suppose.
Yeah, exactly. And we often find that good nutrition starts in the morning, and people often wake up, too tired to exercise, too tired for breakfast, and it's because they didn't get the good sleep. And so, as you said, start with your sleep. If you start to sleep, you minimize the stress for the rest of the day, and it sets you up for a better start to your day as well when you're rested and ready and excited. And it means turning off our devices at a decent time as well, which is hard for us to do in our modern day. So,
I've got a little, my little sort of poem is never see 23. Because I never go to bed after 11.
Yeah, so, I love that.
So if you can stick to that, you'll generally get 7 hours if you don't wake up before 6. But if you're somebody who wakes up before 6, then you've got to never see 10 or never see 9. You've got to make sure that your device doesn't show you that number, and you've got to stick to it.
Yeah, that's great. And it means turning off the device as well and not looking at it, which is also going to allow you not to see it.
Yeah.
So we've got Yvonne has joined us as well. Hi, Yvonne. And then she said, my daughter has tested positive for a bunch of food allergies. We did very difficult food trials, and based on that, only peanuts and eggs are left. Question, is there any point in testing again next year? I don't want her to go through, she doesn't want to go through the food trials again. Yeah, that's a very good question, actually.
Well, that's a great question.
For parents,
that brings up
parents deal with that so much.
Yeah. This brings up such an important question, and that is that sensitivity to food or sensitivity to any allergen is not the same as allergy. We can be sensitized to an enormous number of molecules, but we don't clinically express allergy to them. So you can, if you're a person who's allergic, say, to a couple of foods, there's a very good chance that if you test for a whole plethora of foods, you will end up being positive to a bunch of them. And then it leads to a really difficult situation. Do you avoid these foods or not? So I think in obviously in that sort of situation, you have to now look carefully and see whether or not to exclude these foods. Are they actually responsible for symptoms, or are they not? And I think that the big thing that you want to try and achieve is a tolerance to as many foods as possible. You want to get to a point where you don't need to avoid any foods. So you actually want to sort of bombard the immune system with as much variety of food allergen as possible, so that eventually it sort of doesn't mind what it sees. And so
Okay.
if a child is allergic to foods, they're both sensitized and allergic. It means that they're making immunoglobulin E to the food, and they're having symptoms. It means that they're allergic, and that food obviously can't be given to that child because they have a reaction. But all these other foods that they're sensitized to but not responding to, they should be given, because they will eventually develop tolerance to them. And they probably already have developed tolerance. They're just simply sensitized but tolerant. And they shouldn't be removed. And one of the dangerous things is when particularly children are, really broadly tested for foods, and a lot of the results come back positive, those foods become, are removed from their diet.
Right. So they don't have a resistance.
Yeah. And often the foods are proteins, so they get protein malnutrition as a result of having these foods removed, which actually they were tolerating quite well. So it's important. I think in this particular case, it sounds like this child was really well managed, because the food sensitivity was found, and then it was followed up with sort of the gold standard, which is to actually challenge the child for food allergy, to see if they were really clinically allergic. And in this particular case, only 2 foods were found to be actually clinically a problem. And so those foods have been avoided, and the others, probably the advice has been to feed the child those foods. And so, I think it is important to keep, in touch with your doctor, and to make sure that your doctor is aware of sort of where you're at along the way. And it just depends on the severity of the allergy. If a child has got severe allergy to peanut, and say they're 3 years old and they've just been recently tested and their IgE levels are extremely high, and the last time they were exposed to peanut, they had anaphylaxis. Well, you're not going to choose to test that in a year's time. It's going to take you a few years before you're going to even go near testing for peanut allergy again. But let's just say, a child is allergic to egg. They can tolerate cooked egg, but they can't tolerate raw egg. Or they can tolerate baked egg, but not, lightly cooked egg. But you might want to challenge that child a little sooner, because actually want to include egg into the diet. You can see they're not, extremely allergic, but they certainly are allergic at the moment. But in a year's time, that would be a reasonable test to do to see if egg has now become tolerated. Especially as you want to be able to include these foods in the diet as much as possible. And you don't want children to end up with a whole lot of food allergies as a result of excluding them from their diet.
Exactly. Yeah. No. Thank you so much. That's great, Yvonne. I hope that helps answer it for you as well. Doctor, this has been so helpful and so informative. Thank you so much, guys. I think we're gonna. Candace has talked about her son's allergic reaction to peanuts as well. She says even if she eats anything with peanuts, he reacts. And I think you've mentioned this before, because it can actually become airborne, and that's why it's not necessarily because she's eating it, but the reaction and the sensitivity. So team, what we're going to do is we're going to actually collate your questions, and I'll be in touch with Doctor during the week, and then we can actually go ahead and include it into next week. So you have to join us again next week. So thank you so much, everyone. It's such a pleasure to have you. And I look forward to next week, because we get to dive in a little bit more, which is exciting. So thank you, Cipla, for sponsoring this. And to our Jeff family out there, guys, make sure that you post your questions in the comments, and then I can go ahead and collate them for us, and keep posting them, because I know a lot of you guys are watching this later in the week as well when you catch up. So on the catch up, please still post those comments. I will check them and get them over for our next session next week. So thank you so much again, Doctor, and we will see you next week.
Thank you. Bye-bye.
Bye, guys.